You're just coming home from a knee replacement surgery and you're feeling overwhelmed. As an orthopedic home health physical therapist, I've guided hundreds of patients through their first week of recovery. So I know how chaotic this first week can be. So in this video, I'm sharing exactly what I tell my patients about managing their pain and swelling. I want to help you feel a bit more in control during this crucial first week. To clarify, I am a doctor of physical therapy and a licensed physical therapist, but I am not your physical therapist. So what I'm about to tell you is what I tell most of my patients, but everyone is different. So I want you to take everything that I say as general education and not medical advice. If you have urgent concerns, the comment section is not the place to go. Call your surgeon's office or call your home health agency. I'm just a talking head on the interwebs. Now this next bit of what I'm going to tell you is arguably more important than all the practical tips I'm going to share with you. Before I tell my patients how to manage their pain and swelling, I always give them a little spiel of what to actually expect in the first few days. Managing expectations is so important in this emotional journey that is your recovery. Recovery will not be linear. It will fluctuate. I see people on the first day or two, if they're lucky, saying, "Oh, I don't have any pain. Oh, I can do so much." And then a few days later, they feel like something went wrong, or they're even blaming themselves because they have more pain and they can't do as much as the first couple of days. Don't be discouraged. It's normal, it happens, it's part of recovery. It is absolutely normal to feel pretty good the first couple of days because of the combination of anesthesia, nerve block, and your swelling actually hasn't really kicked in yet. I call this the honeymoon period. Typically, I see swelling start around day 3, and it can go all the way down to your toes and even overflow into the other leg. Another thing to expect a few days after surgery is bruising. It might not be there the first couple days, but it might come and it might be a lot. It could cover the entire back of your leg, and it just depends on the surgery and depends on the person, but don't be too shocked if you see the whole back of your leg down to your toes bruised up. And with swelling and pain, it might feel like your leg is too heavy to lift, or you don't even have the strength to lift it, but it's not a sign of regression. It's just something that might happen during your recovery period. And it's also normal not to have the honeymoon period and you feel all these things right away. Either way, you want to manage your swelling and you want to manage your pain so that you can have control of your leg as soon as possible. That's the goal. Which begs the question, how? The obvious way is to take your pain medications as prescribed. If you have pain medication that's prescribed to you that you can tolerate without any side effects, it would make sense to take it. Making sure that you're on time with taking these pain medications will help you get ahead of the pain rather than the alternative of catching up to the pain, which is a little bit harder. If possible, I ask my patients to try to time their stronger pain medication for about an hour before I get there so that they can tolerate me. Some people I see come home with a little cold therapy machine that they can wrap around their knees, and some people just buy their own gel packs, usually 2 so that they don't have to wait too long to switch them out. Other people use frozen vegetables so that it molds over the knee a little bit better than just a bag of ice. I hear some conflicting information about how long you should ice for. To promote healing, you do want the inflammatory phase, so maybe icing too much might inhibit that. I generally tell my patients that they can have the machine on as long as they want while they're sitting or elevating because they're supposed to be walking every hour to prevent blood clots anyways. Then for ice packs, I say 20 minutes on, 20 minutes off, but it usually doesn't work out that way because of 30 minutes of elevating or walking every hour or having to go to the bathroom, things like that. I generally don't recommend sleeping with the ice or the cold machine because you won't be awake to know if it's too cold and you won't be able to remove it. Did you catch that? You should be walking every hour. I usually say for about 5 to 10 minutes because it takes a few minutes for it to loosen up and for the pain to go away. Try walking in place first to warm up before your actual walk. Not only can walking prevent blood clots, it can actually help with the pain and get your strength back. For the first week, I generally recommend elevating the leg 30 minutes at a time, 3 to 4 times a day. That means lying flat with a wedge under the legs or pillows stacked in a staircase shape, and trying to keep your knee as straight as possible so that you don't get it stuck in a bent position. After a knee surgery, it's just a little bit more prone to getting stuck in a bent position if you keep it bent for too long. While you're elevating, try to keep your foot above the level of your heart or at a 45-degree angle if you can tolerate it. This is so you can use gravity to pull it down from your leg into your body, and the body can get it out of your system. Sometimes my patients who didn't come home with TED hose from the hospital buy compression socks from Amazon. So should you? It's probably a good idea to ask your surgeon because everyone is different, including surgeons, and the types of incisions they have and the types of dressings that they need for you. But I personally like compression stockings because I feel like I see a difference between the amount of swelling before them and after them. It's also commonly used as a way to decrease your risk of getting a blood clot in your lower leg. So if you were given them, then use them. But I tell my patients to take them off at night because I don't want them bunching up and then cutting off circulation, which defeats the purpose of preventing blood clots. If you can't get them on by yourself and you don't have someone to help you with it, it's not the end of the world. I would say just keep walking and doing your ankle pumps. I believe and hope that your hospital taught you immediately how to do ankle pumps in bed so that you can keep your circulation going in your lower leg to prevent blood clots. This is to use your own muscles to pump your blood out of your lower leg. And if you're doing this while you're elevating your leg too, that's a bonus. Did I somehow forget to mention that bending your knee as much as you can and as fast as you can after surgery is recommended? It's a good predictor of a good outcome after surgery, and that's why we encourage you to bend your knee as much as you can with exercises on day 0, actually. These were the key points I usually go over with my patients on the first day, and it's a lot. What questions do you have? Let me know in the comments below, and happy new knee to my favorite new subscriber. See you in the next video.